Next up, we have Associate Professor Samantha Thomas. She's from the Centre for Population Health Research at Deakin University. Samantha is best known for her research examining the impact of sports betting advertising on young people and children. And in fact, I had a short conversation with her before we walked in, that this research is the only research of its kind in the world. Her current research examines factors which contribute to the normalisation of gambling and the role of local communities in the prevention and minimisation of gambling-related harm. Samantha has testified to numerous state and federal government inquiries into gambling, and her research has been presented in the Australian Federal Parliament, the UK House of Lords, and in an amicus brief to the US Supreme Court. She is a regular commentator in national and international media, and it's just such a pleasure to introduce her tonight. Associate Professor Samantha Thomas.
Hello. First, I should say that a lot of the research that we do at Deakin is not done just by me, but by my team, who are sitting all in the back row there. So I really encourage you after this to, they always hate it when I go, oh, there they are. And they came late and snuck in the back. But they really drive what we do. It's very easy for the professors to get up and take all the credit, but they are extraordinary in terms of the work that they do and the heat they take from the industry, and yet they keep going and going and going. I'd also like to acknowledge the people in the room today who have been negatively impacted by gambling, either personally or through someone else's gambling. You are the reason we do what we do. And it's very important that we always remember that this is why we are advocating so strongly for reform. I want today to highlight through the quotes of 10 participants in our research, coming from all different backgrounds and all different walks of life, the pathways to poker machine venues, the harms associated in engaging with these machines, and the responsibility that we have to do something about this significant social problem, not only for Brimbank, but for many communities around Australia. Last year, the Hilda study released, I think, some of the most comprehensive data on poker machine gambling. And what they found was that 41% of individuals who gambled on EGMs, or poker machines, experienced some level of gambling harm. That's extraordinary. It's not the 1.5% that we hear rolled out by industry and government. It is nearly half of all people who play these machines. We also know that EGM venues are concentrated in areas of social marginalisation. Communities who experience social disadvantage lose more money as compared to more affluent suburbs. EGM harm is significantly linked with social marginalisation. The Hilda study again showed that EGM gambling was overrepresented amongst population groups who were vulnerable to social inequity and disadvantage, including those who had less than 10 years of schooling, were retired or lived alone, had the lowest incomes, and who had welfare sources as the main part of their income. Is this a social justice issue for our community? Absolutely. In 1999, 20 years ago, the Australian Productivity Commission placed the first public health policy lens on gambling in Australia. And what they said was that governments should shift away from this individual responsibility, addiction-based framework that had been so co-opted, I think, by the gambling industry, and had really dictated what we did in terms of placing all of the blame and focus on the individual for this problem. And what they recommended is that we should move towards an evidence-based public health approach. So what is that? Well, it's acknowledging that gambling harm occurs because of the interplay between individual factors, sociocultural and environmental factors, industry strategies and their harmful products, and government policies or lack thereof to protect our communities. So what creates the pathway to the pokies? Let's have a look at this first slide here. We know that understanding the drivers of health and social disparities and identifying disparities or strategies to eliminate these disparities are incredibly important in a public health approach. We also know that there are a whole range of different factors that influence why people go to these venues. And in fact, some of them are really good. There are some very, very good things about clubs. And some people in this room might be quite surprised to hear me say that. But there are a whole range of things that we know from the participants in our research that are actually really good for them. Inclusion is one of them. The perception that venues are safe or inclusive environments. The use of venues for activities run by local community organisations. We were at a venue a few weeks ago where they had an All Abilities Bowls Club, for example. Things that are not offered elsewhere in the community. Places of coming together with your family for cheap meals and entertainment. But there are also some things under that same roof that are incredibly problematic. Have a look at this quote here. I'll read it out. I can only kind of see half of it, but I understand this is being recorded, so we'll make sure that this gets on the quote. Here's a person who participated in one of our recent studies, and they say, the thing is, if you're sitting home on your own for maybe a whole weekend or 3 or 4 days with no contact, you just think, I've got to get out. So you go somewhere where there's going to be people. And even when you're playing the pokies, you might chat to the lady or the gentleman next to you. And you don't feel isolated when you're in an area where there's other people. That's extraordinary. That the place where lonely people go in our community to get some kind of social interaction and contact is in a poker machine room. If we have a look at the next slide, we'll also see that a lot of people use poker machine venues as an escape from their everyday worries. People describe this, and this is some research that's been done by our team recently with older people, and they say if you're in the pokey room because you can feel the atmosphere, there's something to keep your mind off everything going on around you and your own personal life because you're playing the machine. And it's good fun if sometimes it rings and if the money drops out. It's a beautiful feeling. It's a lovely sensation. Again, incredible how people conceptualise their relationships with these machines and ultimately the harm that they experience from them. Research conducted by Amy Bessman and our team showed that while most people don't attend gambling venues for pokies, those who do are often at much higher risk of gambling-related harm. Those who attend an EGM venue at least monthly, whether they go for pokies or not, are significantly more likely to report EGM use compared to those who went to an EGM venue much less often. So the more regularly you go to a club or hotel, the more likely you are to engage in poker machines and to experience harm. Next slide, please. There's also a perception that venues are family friendly. There's a lot of marketing that goes on around these venues. They have playgrounds, they have kids eat free and cheap meals and so on. And a lot of people go to these venues because they are places where they can take the kids, where they can have a cheap meal, and where the kids can play while the adults sit and have a meal. My kids belong to our local basketball club, and they had the local, inaugural, the start of the season team managers meeting at a local hotel because it was the only place in our region where they could find a place with a playground that would keep the kids entertained, they could have a cheap meal, and the parents could have a glass of wine while they had the meeting. We have to provide alternative spaces for people who don't necessarily want to go to those venues. Here's a quote from someone who says that they live across the road from the pokies. We mainly go there for food. I used to play the pokies a lot. I think most nights kids can eat free, and so it's quite a good family place to go, and the food's quite good. So mainly we go for food, but when we went there the other week, I think I put $20 through. Now that might not seem a lot, but for someone that might mean not being able to pay a bill, not being able to put a good meal on the table for their children at night. We also know that children who regularly attend poker machine venues are much more likely to say to us that they'll play pokies when they're older. Again, research done by Amy Bessman, if we go to the next slide. Amy's spoken a lot to young people who attend these venues and about what they can see and hear within the venues. Just because your child is not sitting in front of a gaming machine doesn't mean that they're not exposed to that machine in some way. If you think about it, most gaming machines are next to the bistro. And a lot of children report being able to see flashing lights, being able to see their sounds. And of course, as we all know, the only sounds that poker machines make are positive sounds associated with winning. So here's a 12-year-old. He says about his experience in the local club. You hear the money hitting the metal, and then you hear ding, 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 and then the big winner sign lights up on the top of the poker machine, and everyone screams, "Get the money." We go to the next slide. We know also that the vast majority of people who participate in these machines also know that they are incredibly harmful. We go to the next slide, please. I'm really thrilled that Brimbank is taking on this issue of long opening hours, and here's a quote that shows why long opening hours are so incredibly problematic. This is a young man talking about his experiences. He said, "I just turned 18, I got my licence, and my friend said, we'll go down the pub and we'll go in the pokies." And I thought, all right, yeah, we'll go in. I just got addicted then. It just wrote me in. We used to go to any venue all around Melbourne. If that pokey venue is not paying, the machines are not paying out, you go to a different one all night. That was every day of the week. I had to get up for work the next morning. I only went home for an hour's sleep and then get up to go to work. Again, if those venues are not open as long, these stories don't happen. Next slide, please. We also know that there is an incredible impact of stigma. We know that responsible gambling messages have a huge impact on people's ability to seek help, and also the shame that they feel from their poker machine gambling. This is probably one of the most powerful things I've read in recent times associated with the research we've done. This is an older lady talking about the shame that she experiences from pokies, someone relaying what she had been told. She said, "Do you know what I've told my sister? If I die before her, she's to get to my drawer and get my bank books and bin them, so the family doesn't know what I've spent in these machines, what I've put through these machines." That's extraordinary. It is the most stigmatised of all of the addictions. So what do we do about this? Well, I always think that great leaders run towards problems, not run away from them. And so here are some of the things that I think we need to, or some of the challenges I think we need to overcome if we're going to move forward. Next slide, please. We know that the vast majority of people are incredibly supportive of restrictions on poker machines. We know that they support clubs which do not have poker machines. We know that from our research, the vast majority of people say that they would prefer to go to clubs without poker machines, that they would prefer to see that clubs are less reliant on the revenue from poker machines, and they would like much stricter regulations from government around the products. But people are also cynical about government's willingness to act. I think pokies are the most harmful because they're designed to not let you win. At the press of a button, your money is gone. They're designed to get you in, to get you hooked. And they don't care about the damage they're doing, talking about the industry, and neither does the government because it benefits from regular people losing their money. And I think that's the elephant in the room, that we have a government that is highly addicted to the revenue from these machines. Next slide. We need to dispel the myths. I won't read this out, but this quote talks about someone talking about Western Australia. Western Australia seem to be doing pretty well without gambling in their community. EGMs are only allowed in the casino in WA. They're thriving without pokies, and someone mentioned that they even just won an AFL premiership without poker machines. We go to the next slide, please, and the next one. Many of us in this room know that there are quite significant advocacy restrictions in the work that we do, and we need to start to band together to remove those. Advocacy is a key pillar of public health. We cannot do public health without advocacy. It is incredibly important that we are independent and that we are able to advocate based on our research evidence for our communities. We have to get rid of the advocacy restrictions that are around so many of our services, so much of our research, and so many of our prevention efforts. Here's one of the stakeholders in our studies. They say, I think the other thing is independence. So the ability to actually frame issues and raise issues from the local level without those issues being watered down, filtered down or disrupted. Next slide, please. It's time, I think, for governments to start being responsible, just like we were with tobacco, just like we've been with seatbelts in cars. If we look at all the other public health issues, this person says, if you look at smoking, you look at tobacco, you look at seatbelts, the government has taken responsibility to keep our community safe. But here, all the responsibility is put on the individual. That doesn't make any sense. So what do we do? Last slide, please. I think it's time for our communities to demand change. We know that good public health policy is created when there is pressure from communities on governments to make changes. I'm going to leave you with this last quote, and I think it sums up that we should all get involved in what I think is an incredibly important issue for our communities. It's community groups, it's normal citizens, it can be civic groups, it can be religious groups, it can be neighbourhood groups, it can be individual citizens, it can be anybody in the community. Thank you.